Further ado, I'd like to introduce today's speaker, Dr. Clare Purvis. Claire is a psychologist and behavioral scientist who has spent her career using technology to help people live healthier lives. She led product teams at companies like Headspace, Mindcure, Lantern, and Violet to create programs that support health behavior change, and has consulted with organizations from Google to Sanofi on launching new digital health solutions to millions of people. Today, she's tackling a bigger problem. Women deliver most of the healthcare, but men still hold most of the power. The lack of women in leadership slows innovation and leads to worse health outcomes for everyone. To change that, Claire founded Well, a leadership accelerator and professional network for women in digital health. Well specializes in helping women with clinical and scientific expertise strengthen their business and leadership skills, and by helping connect the wider community of women across the digital health industry who are driving the next wave of innovation. We are so grateful that Claire could make the time to join us today. Claire, thank you for being here. And with no further ado, I will pass it to you.
Well, thank you so much for having me, and thank you for that wonderful introduction. I'm really excited to be meeting with you all today, and diving into what I'm sure will be a great conversation. Let me go ahead and dive in. I've got some slides to go through. I'll try to keep my remarks on the briefer side, as Graham mentioned. Would love to make sure that we have time to answer any questions that you have before the end of the session today. Okay, let me see. Can everybody see my screen? The refrain of our modern world here. I see some thumbs. Perfect. Okay. So as mentioned, today we're going to be talking about the future of industry. But as I thought about, this community and also a lot of the work that I do, we're specifically talking about the future of clinician-led innovation in behavioral health tech. That was a wonderful introduction. So I'll keep this really short. But for those who don't know me, I'm Claire. It's great to connect with all of you. I'm a clinical psychologist by background. The mission that drives all of the work that I do today is to empower clinicians and scientists to become exceptional business leaders so that we have the confidence and the skill to drive the digital health industry forward in a positive direction and really create impact at scale. I know we don't have our chat feature going today, but I'd love to just see some thumbs, maybe some reactions to let me know who's in the room today. Could you shoot up a thumb if you are a clinician or scientist? And maybe do a heart, or if you have other emojis you can do a heart if you are currently working in or with a startup company in digital health. Great. Okay. And I don't know what else we have. Maybe we have a lightning bolt or something like that. Show me if you are thinking about joining a startup full time or launching your own startup. Oh, we've got party hats. Great. Okay. Okay, so we've got folks across the board. Wonderful. Um, Before we dive in, also, one more question for all of you. We can use thumbs for this one. Whatever your engagement with the digital health sector looks like, I'm curious, have you ever found business speak, business stuff, to be confusing, complicated, or overwhelming? Have you ever felt out of your depth on the business side? I see some thumbs going up. I'm putting my hand or thumb up as well. I have felt that way also. Um, So why does this matter, right? Why are we going to spend our time today talking about clinician-led innovations in industry? Um, this is a really important place where we have the opportunity to level up our skill set as clinicians and scientists. And my strong view is that the industry really needs us to step up and to be fully engaged and empowered agents that are influencing how digital mental health companies operate. And to do that, we need to be able to have commercially oriented conversations, not only to think about these companies or these products or these solutions from a clinical or scientific point of view. But a big concern that I hear when I talk about this stuff is that business stuff is so complicated, right? Financial models and cap tables and growth metrics. Oh my. So, my first secret for you today, and a theme that's going to go through our entire talk, is that the basics are beautiful. Focusing on the fundamentals of business viability in healthcare really puts you many steps ahead of quite a few digital health entrepreneurs and even investors. So you're not going to see anything today about financial models, about cap tables, about complicated projections or calculations, because you don't need it. And I hope that you'll see that today. So on that note, I have two big goals for you today. One is that you'll see how simple some of the fundamentals really are. I can guarantee you that your PhD was harder for those in the room who have a PhD. And the next is that whatever your involvement is with the digital health industry or with startups in this space today, that everyone will leave this session feeling prepared to go forth to have confident, meaningful conversations with founders, operators, investors in the digital health ecosystem so that you can use your expertise to help more companies do great work that helps more people. Does that sound good? Are we on the same page for goals for today? All right, so how are we going to do that? We're going to do this in three parts. First, I want to walk you through a three-step viability evaluation framework. This is something you can use really with a variety of different types of healthcare, excuse me, with startups, but this one is going to be tailored for healthcare and specifically mental health. And then we're going to put that into practice. We're going to do a real world case study. We're going to use our emoji reactions. Well, thanks for practicing and warming up. We're going to do a case study practice together, and then we will have time for Q&A. All right, so let's dive into it. We are going to start with a three-part framework that you can use to assess the business viability, to assess any business model and get a sense for its viability. This process that we're going to look at is uniquely tailored for digital health, but many of the principles are going to hold true regardless of industry. So we start this framework with what and who. What problem does a company solve, and who do they solve it for? And who pays to solve that problem? So let's break those down one by one. First, what problem does the company solve? Our first step, which often is challenging right off the bat, is to identify one primary problem that the business solves. Now, technically, if we think about digital mental health, there could be like thousands upon thousands of specific problems that a digital mental health solution or company could solve. So what we want is a really clear framework that we can use to categorize those into distinct types of business problems that that startup could be addressing so that we can really make sense of the market and of any company easily and quickly. So when it comes to digital health, and digital mental health is included in that, the whole point of this endeavor is to improve on the status quo in healthcare, right? That means that any digital health company can be understood in terms of what core healthcare problem it solves. And in healthcare, we can boil almost everything down into three major issues, three big problems that any startup company could potentially address. And those we can categorize as access, cost, and quality. So let's look at each of those from a mental health lens. We'll start with access. What are we talking about here? Really, this is the question of can everyone get care and can everyone get coverage for care when and how they need it? And this is a group of largely clinicians and scientists. I know I don't have to tell you this, that in the United States, we have a fundamental problem of access, even from a coverage perspective, right? At least 9% of our population have no health insurance at all. And that number will only increase, right, with new recent changes to coverage for Medicaid. And as we all also know in this room, despite the prevalence of mental illness, treatment access is consistently poor. It's a huge, important problem. So the distribution, we know that 1 in 10 of people with a mental health condition are actually getting the care that they need. Many drivers of this, right? Distribution of providers is one factor that we can think about, and certainly very relevant to digital mental health companies. The problem we always hear about is that almost at least half of US counties lack a single psychiatrist. And provider shortages are certainly disproportionately affecting rural communities. And so we can think about this problem of access from that particular lens. Many people, I know I don't have to tell you all this, that many people have said or have used the term that we have an access crisis when it comes to mental health. And we've seen many, many digital health solutions, many digital mental health companies that are oriented around solving fundamental problems of access. How can we get more care to people that need it? My mouse is stuck here. There we go. So then that leads us to the issue of cost or the problem of cost. So in healthcare innovation, when we're talking about cost, we're talking about the total population level cost, how much we spend delivering healthcare. And in the United States, that number is huge. I think it's about 4 trillion annually by the last report. But the question is really around value. So yes, that sounds like a big number, but are we getting the value that we pay for with our healthcare spending? And in the United States, the answer seems to be resoundingly no. So our cost for healthcare has increased faster than any other comparable nation, but our life expectancy has not improved at the same pace. You can see we're the red line on that graph here on the screen. So we're paying about twice as much to be less healthy. And mental health spending in particular accounts for at least 200 billion in direct spending costs, with that number, recent estimates being a bit higher than that. And there's also a lot of downstream costs when we think about mental health. So people with mental health conditions make 6 times as many emergency room visits as the overall population, which is another cost driver for payers of healthcare. And mental health, specifically depression, is a leading cause of disability. So the amount of money that companies are spending on mental health for their employees has also been rising rapidly. And then finally, this brings us to the question of quality. So in healthcare, quality is measured in terms of clinical outcomes and patient experience. There's lots of different measures we can use for quality. And I know many of you will be focused on efforts to improve the quality of different treatments that we deliver in various different ways. Um, so the goal here is around one, recognition of the variability and quality of care as it's delivered, gaps in quality of care. And it's a huge focus for many treatment developers and mental health innovators who are working to make care more effective. Today, we know that there are many, many barriers to delivering high quality care at scale in mental health. These are just a few of the gaps that we know about. So why am I talking about all this? We started here with the first 10 minutes we're talking about clinician-led ventures and business viability, and I just gave you sort of this macro level healthcare lecture. So what's going on here? Here's the deal. These problems are always in tension with one another. So if you've got a digital mental health venture, or you're looking at a digital mental health company, and they're talking about their solution and the impact that they're going to make, what are you likely to hear them say, right? Better, faster, cheaper. We're solving all of these problems. We're going to radically expand access. The care is going to be less expensive. We're reducing costs for payers. Providers love us because the quality is incredible. The truth is always more complicated than that. The concept that I want you to remember here is the iron triangle. So, healthcare innovators have talked for a long time about cost, quality, and access as an iron triangle, meaning that it's not possible to improve all three of these at once. And now that is overstating it. It's not strictly true that we can't improve all three of these at once, but as a general rule, they have inherent relationships to one another. If I improve one corner of this triangle, I will create a consequence on one or both of the others. So let's think about this from a mental health example. Let's say that we could wave a magic wand, and starting tomorrow, everyone who needs mental health care access gets it, no exceptions. So in that scenario, what problem are we focused on? Thumbs if we're focused on access. If we're focused on quality, give me a heart. If we're focused on cost, give me a party. So if we want everyone who needs mental health care is going to get it, no exceptions. We're focused on access. We're focused on expanding access. So let's think about this like healthcare innovators. How would we do that? We know that we can't scale access to one-to-one direct care from a psychologist for everyone. So what can we do instead? As many of you are working on solutions like this, you'll be aware we could rely on, we could think about other types of programs, right? Maybe peer counseling, maybe hotlines, maybe digital content, maybe AI chatbots. And in most of those cases, there can be a nuanced conversation about this, but in general, what we're saying in looking at solutions like that is that the quality of care that each individual person receives might be lower than the gold standard evidence-based practice delivered by a licensed professional. But in thinking about the relationship in the triangle, the important thing to keep in mind here is that we're basically saying, look, our priority is to expand access. To do that, we might be okay with quality flexing, with quality going down to some extent, because our goal is to expand access. And to do that, we can't increase them both at the same time. We can't insist on one-to-one care for everybody if we really want to radically expand access for 300 million people in the country. And then we have the question of the relationship between access and cost in this example. So if we radically expand access, and now 10 out of 10 people with a mental health condition are receiving some sort of care and support, does the total cost that we're spending on mental health care go up or go down? So at the end of the day, even if we're scaling lighter weight, somewhat lower quality solutions, we're still yielding higher overall spending, right? Because something costs more than nothing. So when we focus on solving one problem, access, there's inherent pressures on the other corners of the triangle, right? Costs typically go up, at least in the short term, at least as a line item. quality might decrease. These three are always in tension, right? And it's really, really essential for us as clinicians and scientists to keep in mind that any digital mental health company needs to be able to identify what is the primary problem that I'm most focused on addressing. They have to be clear about the main outcome that they want to achieve. And they need to anticipate the impact or the consequence on cost and quality and the extent to which that will matter for their adoption in the system. So when we're evaluating a startup company, we really want to think about the relationship between these problems at a macro level so that we can ask great questions and be really well positioned to understand the bigger strategy or potentially lack thereof that this company has. So we want to be able to engage in conversations like, hey, I noticed that you're focused on expanding access, for this population, for this type of indication. How are you solving that? What are your bright lines on quality? What will you accept in terms of outcomes that is going to ensure that the support you're providing is still effective? How are you thinking about cost implications of that solution? How's the population level cost going to be affected? How are payers responding to that? Or what's your relationship to payers who would be looking at total cost? These are the types of questions we want to be able to bring in even to an early evaluation with a startup company. And then we want to look at who has the problem that they're solving and who pays to solve it. As with problems, we got three main stakeholders in the digital health ecosystem, in healthcare broadly, excuse me. We got patients, providers, and payers. So quick recap, I know you all know who these are. With payers, we are talking about intermediaries who pool and distribute money to pay for healthcare goods and services. Really complex group, lots of types of payers, but we're talking about entities that reimburse for care that's delivered. Providers, many of us are on the call. We're talking about clinicians, people that deliver goods and services, vendors, different sorts of suppliers can fit into this category as well. And then patients, we've all been patients, the people who are actually receiving healthcare services, healthcare products, all of us. And each of these stakeholder groups has their own goals. They have problems that they're primarily motivated to pay to solve. And when we look at a company's value proposition, what we're listening for is a good match between the problem that they're solving and the stakeholder who ultimately pays to solve it. And it matches up a lot less often than you would think when we start to look at digital mental health companies and digital companies in general. So what are these groups trying to do? Payers first. Payers want to manage the costs and risks associated with paying for healthcare. So as a health plan or as a self-insured employer, I'm going to be ultimately primarily focused on making sure that my costs are under control. Doesn't mean that they're never going to care about quality, doesn't mean they're never going to care about access. But the thing that they ultimately have to prioritize is cost. For providers, of the three, this is the group that's going to be most concerned about quality, most motivated to solve problems related to quality. And in many cases, there's a financial upside for provider systems or health systems to deliver better outcomes. Maybe they get better reimbursement rates, et cetera. There's also an intrinsic motivation. The role of providers is to deliver treatments that help their patients, right? That's what we do. And so there's kind of this inherent orientation towards treatment quality and treatment improvement among provider stakeholder groups. And then patients as a group are the most concerned of the three with access. We're the ones who experience that problem, right? We want it to be easier, more convenient, a better experience to get care. So of the three, patients are going to be most concerned with access problems. Again, doesn't mean we don't want to get high quality care, doesn't mean we don't want population level costs to be contained, but those aren't our primary motivators when we're looking at value propositions. When we put this all together, when we know what problem a company solves, for whom, and who pays for it, then we know the value proposition of that company. And this is something that we always want to listen for when we're talking to digital health ventures or to startup companies. How well can they define the problem that they solve for a specific customer segment? How clearly can they define that segment and why they want to pay for this solution? And the key word here is customer, right? Who actually pays for the company's product? So very often digital mental health companies try to sell a solution for someone else's problem. They sell a quality solution to a patient customer segment. They sell access solutions to payers, and they find a lot of friction in the market doing that. So we want to listen for clarity in a company's value proposition, and we always want to interrogate a mismatch when you hear one. There's also a huge consideration in healthcare here that many of us will be aware and have used ourselves, that there's a digital mental health solution where patients use the product, but payers fund it, right? There's two different stakeholders involved. So we need companies to be able to be really clear about how they solve problems for the paying customer and how they solve problems for the end user. We need to be able to hear or discern how are we going to prioritize how we solve problems for those two groups. But so often, especially with clinician-led ventures, especially for those of us who are really passionate about creating great products that deliver great care, we kind of forget about the customer side of that equation. We kind of forget that the person we're building this product for might not actually be the entity that pays for it and distributes it. And we really need to think through that value chain in order to be successful. Okay. I'm gonna move to step 2 in our framework, and reminder that the Q&A is open, so you can pop those in there if you have questions as we go, if you don't want to lose track of it. Let's talk quickly about kind of step 2. I call this our environment check. So when we're thinking about the viability of any new digital mental health startup, we want to understand how is this going to be received by the broader healthcare ecosystem, by the environment that it operates in. How will this company kind of play within status quo incentives that drive decision making in this ecosystem? If your eyes are starting to glaze over at the talk of incentives and market, hang in there. We're not going to spend too much time here, but it's really important to touch on. So what we want to think about is how rigorously we talked a bit in value propositions that at a starting point, we want to see alignment between what problem are we solving and who has the problem. We also want to think about who pays for the problem and whether we still see alignment there. So when we zoom out to environment, we want to think about who are this company's friends in the healthcare ecosystem. If we're really, really successful with this company, if we do everything that we set out to do and we just knock it out of the park, who else is going to benefit from that? Who else sees some upside for that? Who else gains from it? Are payers going to love this because we're being able to reallocate or distribute costs differently? Are providers loving this or improving quality for them? Are there powerful entities in the ecosystem who have something to gain from our success? And then importantly, we want to think about the flip side, right? Who are the foes of this company? If I'm really successful, who suffers for that? Who loses business? Who loses market share? Who's not getting to bill for the services that they currently bill for? Or how powerful are those stakeholders? Okay, I want to show you a little bit of detail on that. Why does this matter, right? So healthcare entrepreneurs consistently get this part wrong. And what have we talked about so far, right? Have we talked about any finance models? Have we talked about anything that you needed an MBA to understand? No. Healthcare entrepreneurs consistently get this wrong and companies fail for it. So we don't need to be super advanced to understand the fundamental likelihood of viability of a healthcare venture. We need to understand its value proposition. And does that pass the sniff test? Does that make sense? And understand its position in the environment, in the broader ecosystem. As clinicians, you are fully equipped to unpack and understand those concepts. You are well positioned to lead within companies, to advise them, to launch your own ventures when you understand these fundamentals. Because the basics are beautiful, right? We want to get clear answers to the problem being solved, who has that problem, who pays for it, and why do they pay? And if you're successful, how do you fit inside the status quo incentives? Who's gonna be creating some tailwinds? Who's going to benefit from your success? And are there any important or strong enemies or foes out there who are actually going to be squeezing this new venture's likelihood to succeed? And then we have one more step to think about, taking it one step further. This is where we start looking at the financial stuff, but not in excruciating detail. This is where we think about the unit economics and the financial viability of a startup company. So every venture of every kind distills down to unit economics, right? The terms that we want to remember here are LTV and CAC, and I'm going to say a little bit more about those in a moment. But if our company, any company, the factory making widgets, right, can produce 1 unit of something for a cost of X, and a customer is willing to pay Y for that unit. If I can make more money, if Y is bigger than X, if I can make more money selling this widget than it cost me to produce it in the first place, then I can make a profit. I can be viable. And every business can be understood in these terms. We can break it down into its units. And to get the essentials in place, we really don't need to go further than that when it comes to financial modeling. So to translate, lifetime value or LTV of a customer is the total amount of revenue that a customer is going to spend with a business over the course of time. LTV ultimately, lifetime value, would need to be bigger than customer acquisition cost or CAC, which is the amount that we had to spend to get that customer in the door in the first place, to get that contract signed, to get that customer to get our product. And we've all heard the stat that 98% of startups don't make it. But what is the leading cause of startup death? It is finding out too late that LTV is not bigger than CAC and it never will be. Ultimately, it means we ran out of money. That is the leading cause of startup death. So here's what we want this to look like. Most startups, all probably, start off with a really high cost of acquisition and a fairly low LTV. But they have a forecast or they have a logical plan toward a projection point where they flip into profitability. That's the break-even point where we move into the promised land. For any new startup or any new entrant into a market, LTV is not going to be bigger than CAC from day one. And that's okay. That is normal. But what we want to understand is what is it going to take to get to that break-even point? What's the plan to get there? And what do we need to be asking about or thinking about to understand that? We need to understand what drives lifetime value, which has to do with how many people are actually out there in the world, in the market, that we could sell this to. We want to hear at least a common sense, logical story about how a company has sized that market and what their potential is. And of course, we want to hear about pricing and all of those things. On the acquisition side, we want to understand what are all the ways that we can actually acquire the customers that we need to sell to? What does it cost to do that? Do we have to advertise? Do we have to have an in-person sales force going out to provider offices? How do we get better? How does this company get better over time and more efficient at acquiring the customers that they need to over time? You don't need to be calculating out market sizing, TAM, SAM, and SOM yourself. What you want to be able to do is ask those questions, listen for logic that adds up, and have it pass the sniff test. If we're thinking about, do I want to get involved with this company in the first place? And just to take this one step further, it can be helpful to have a frame of reference for some of the common revenue models that work in digital mental health and in digital health broadly. So there is no one correct revenue model to rule them all. They all have their own challenges, right? So what we want to hear, again, initially, is who's going to pay this company money, and how are we solving a problem that's important enough for that type of customer to pay money for that solution? And then we want to just think about what are some of the well-known challenges in the revenue model that this company is building, and how are they thinking about solving those? Like, what is the plan here? So let's think of one really common example. We've got four revenue model types on the screen. We've got subscription, SaaS, marketplace, and e-commerce. I want to talk about subscription today. I think we're most familiar with that. We see a lot of companies in this space that are building subscription models. So with subscriptions, we're typically selling to consumers, right? We'll just stick with that. We'll stick with selling to consumers for subscriptions. And when we think about the lifetime value that they could achieve, we're usually looking at specific metrics like annual recurring revenue, ARR. That really just means how much can we charge for this subscription and how many people are going to buy it and how many of those are going to happen over the course of the year. So how much total recurring revenue can we earn per year? And what do we know about what's challenging with subscription models? Well, for competing in the consumer market, that means we have to get individual people to pay out of pocket, put their cash on the table for this product or this service. That typically means that the price that we can charge needs to stay relatively low, and we need to acquire a lot of people to get this business to work, to make enough annual recurring revenue to succeed as a business. And because we have to go get a lot of customers, the costs to do that are going to be really high. We've got to get out there in the fray, right? With every consumer business, we have to pay for advertising. We have to reach a large number of people to start subscriptions. And then we have to keep acquiring people all the time because a lot of our customers are going to churn out of a subscription and we need to replace those and keep growing at the same time. So when we're looking at a direct-to-consumer subscription company, we know we better have an awesome value proposition for consumers. We better be fixing an important problem that they care a lot about solving. And we better have a big enough market. There better be enough people out there that we can keep finding customers and acquiring them. So we want to have a really great plan for acquisition, some sort of idea of how we'll get more efficient or better at acquiring customers over time, because it's going to be really expensive for us to do that. And a lot of digital mental health companies, the revenue models may change over time. They might start with a consumer subscription and then ultimately realize that those unit economics just don't really work for them, or they're not sustainable over time. And they start looking for more leveraged models where they can sell to employers or health plans, maybe on a SaaS model. Um, that's not necessarily a bad thing. It's very common in the industry. But the thing we want to remember is that we do want to be able to interrogate the revenue model from day one so that we have an idea, what are the big challenges going to be for this company? And do they have a plan for overcoming those? Do they have kind of a realistic sense of what it might take to succeed in the market? Companies might not have it more dialed in than that, and that's okay. We're all out here trying to figure it out. So we're really listening for logic and cohesion in a story and a reason to believe. Okay, I have a case study for us, which is going to be fun and interesting with just emoji reactions, but we're going to try our best. We want to see this play out in real time. So we want to look at a real company, and we want to apply these steps of this evaluation framework to try to figure out its viability. Like, do we believe in this company? Do we think it's going to make it? So we want to ask those questions from our framework to try to decide, is this business going to succeed? And to play with these concepts, I really find it helpful to step outside of our comfort zone or our area of expertise, because we can get kind of sometimes almost too bogged down in the details when we know a lot about the subject matter. So I picked a company that is not in behavioral health to use as our case study company. And I want to see, like, let's see what we can figure out about this company. Let's decide, let's put on our investor hats, if you will. Let's decide whether we would invest in this startup or whether we would work with this startup. You ready? Let's see some thumbs if you're ready. Fantastic. Thanks for playing along, everyone. We're gonna do our best here. Okay, so this is a real company, but I've hidden the name for now. And I'm going to read out our case vignette. It's intentionally very brief. We're not going to use a ton of information to make some of these decisions. So, Company A, as we'll call them, is a healthcare startup that sells an app to match patients receiving cancer care with clinical trials. The platform enables cancer patients to learn about and match with clinical trials from a global network of cancer centers without leaving their home. The service is aimed to streamline the complex process of finding and enrolling in clinical trials and solve the problem of low enrollment in these trials. The service costs patients an initial fee of $3,000 plus $20 per month subscription thereafter. Okay, we can pop back to this and get to look at it as we go. This is all we know for now about Company A. This is all we're going on. So let's use the framework that we just learned. First, what problem does this company solve? So show of thumbs for cost. Does this solve a population level cost issue? No thumbs are being raised. Show of thumbs, quality. Does this company solve a quality problem? We've got an emoji reaction. Okay, we've got a few. Got a few coming up. And show of emojis. Does this company solve an access problem? Okay, we've got a ton of thumbs on access. Fantastic. Okay. I want us to pause here because this is a tricky, sneaky little company and a sneaky little value prop that they came to market with. So, who decides what counts as an access issue? Who defines problems of access ultimately? It's patients, right? So I want us to look with a critical lens at this vignette. Who is eligible for this service? Thumbs, I'm not sure how to do this with chat, but is it people that don't have any access to treatment? Or is it people who do have access to treatment already? Yeah, they do have access to treatment already, right? So this is a really interesting way that the company tried to frame their value proposition. This is a platform that enables people who are receiving oncology care in some form or function to attempt to match with clinical trials that they might not otherwise have attempted to enroll in? Is this about getting treatment in the first place, or is this about getting better, potentially better care? Hearts if better, thumbs if any. Yeah, this is actually about better care, isn't it? What does that make us think of? Is that more about access? Or is that more about quality? Improving the quality of treatments that are being delivered. It's a quality problem. These sneaky little founders. So if we think about it in in these terms, now we're looking at this with a different lens, right? So what happened here? They position themselves as an access solution, but when we break down what problem were you actually solving and for whom, we're starting to see, wait a minute, a fundamental issue of access doesn't seem to be the real focus here. This seems to be about getting people into better or more specialized or more tailored care in some cases, which sounds like it could be a quality issue, actually. So now we want to think about, we want to continue to go through our match and look at it from this lens. When we think about the problem that way, a quality problem, we want to think about, well, who has this problem? If we're now suspicious that this isn't an access problem, we're thinking about a quality problem. Who has the problem of enrolling patients into clinical trials? Well, now this makes us think about like cancer centers, research institutes, pharma companies. But in this business model, who pays for this solution? In this business model, patients pay an upfront fee of $3,000 and a $20 per month subscription. So the patient is paying for this solution, which really begs the question when we think about all these different value propositions that might be relevant for patients receiving oncology or cancer care. We want to think about one, where does this fall in their priority list? And two, like to put it bluntly, is cancer care in this country generally cheap or generally already expensive? So where's the ability for this market to bear the cost of this solution? We're going to get into that in just a second. Um, I skipped ahead a little bit. We're already starting to see this mismatch, right? What problem are they actually solving? What is their primary concern? And who has the problem and who pays for the problem? We're starting to see some problems there. And then we want to think about how do we align within the environment? We don't know a ton about this company, and we could likely come back to this question later in our framework, but what we know kind of off the bat is who would really love this solution, who benefits if they're really successful. Um, Maybe the institutes or the centers that are enrolling into the trials, possibly pharma companies if they're developing new drugs, and if this accelerates that for them. Maybe certain patients. There might be certain patients who really love this solution, but we don't know a ton about that. So what's important that we want to look at here is lifetime value. It's the revenue model for this company. Um, this is a direct-to-consumer subscription, right? Technically, it's kind of a funky subscription. We've got a big one-time fee plus recurring payments. So when we start to break this down, I'm curious, thumbs versus hearts, how big is this market? Like, how many patients are out there that are eligible for any of the clinical trials that are going on? Is that a huge market or a small market? Let's say I didn't tell us which emoji means which, but we have some votes coming in. A little back of the napkin math, just again, thinking about not being finance professionals, but kind of thinking through LTV. Okay, if we forget the recurring charge, because that's a really minimal part of how they make money, and we just think about this upfront fee of 3,000, how many patients would need to be enrolled into this platform every year just to generate like 10 million in revenue? We need about 3,000 patients enrolled every single year to get to recurring 10 million in revenue. But how much do we need to break even? This isn't a really advanced technology, most likely. It's probably an expensive system to build and maintain. And how are we acquiring these customers? Are we doing direct advertising? I don't know. This is maybe we need a sales force that's going out into actual centers, cancer centers, to talk to providers to get referrals. Um, are there any regulatory concerns around how we can position a market? It sounds like this could be expensive to sell, kind of like how pharma companies sell. They spend a ton of money on their sales force to go out into the market. And and get providers, recommending these treatments. So at this stage, in modeling that, what I'm hoping to demonstrate is you can always kind of think it through back of the napkin, common sense, logical. We don't have to know all the exact numbers. We hope, though, if we're talking to a founder, we can see some kind of logic and math and how they put it forward, and then we can see, does that jive? Does that add up to me? Do I have a reason to believe? But pausing on our company here, do we have a good match so far? And do we have good market logic? Is there a match between problem and payer? Is there a match between problem and end user? Does it have a good position and environment? We're not totally sure. And does it have a solid revenue model where we say, yeah, we're gonna print money. People can't wait to pay for this thing. Those are the ways we want to be thinking about it. So, was this company viable? I don't know if you have a thumbs up and down. We could use that one. Hands up or thumbs up if you think this company worked out. And hands up if you think this company failed. Yeah, we have a lot of votes for failed. This was a real company, as I said. Remember when I said what the leading cause of startup death was? It was running out of money. We ran out of money. That's what happened to this company. So this company shut down 2 months after launch due to complete lack of traction. So they couldn't get anyone to sign up for this platform. No one. And I'm curious, how much do you think they raised? There's no good way for me to ask you that in this format, so I'll just tell you. This company raised $100 million in their first round, pre-launch. $100 million raised and shut down after 2 months because the value propositions, those fundamentals, right, just didn't make sense. And people wrote about this company at the time. Healthcare writers and healthcare innovators kind of suspected something smells fishy here. But the company launched, and then we saw it play out in the market in real time. But what's important here, I want to look at what you all just did. You all just made a better investment decision in 5 minutes than a bunch of VC bigwigs in Silicon Valley and all around the world did. And you did it purely based on thinking through the fundamentals with a logical frame. This stuff is not as hard as they make it out to be. It's really not. This is not a time for any clinician or scientist in healthcare to feel unqualified. Your voices are critically important in shaping the direction of healthcare innovation, of driving companies forward to make a positive impact. You have all of the skills that you need to engage in this field already, and you absolutely have the ability to learn and grow your skills to be equal thought partners when it comes to commercial decision making in the digital mental health ecosystem. So you don't need an MBA to go and ask questions, to engage in this, to learn about business viability, and to have your voice really be meaningful in those conversations. So I want to pause there because I know we want to save time for Q&A. So I will pull down my slides and we'll open it up to Q&A. If that sounds good for you, Graham, let me pull these down. Here we go.
That sounds great. Thank you so much, Claire. That was so illuminating and so exciting at the same time. The speaking of access, the way that you make this feel accessible is it's really, really exciting. So
Thank you.
yeah, absolutely. So I'm going to get started with a couple of questions here that we have. And please, like, we only have a couple of questions right now in the Q&A. So please, other folks, I have some questions for Claire, but please feel free to go ahead and add your questions here. I think that something that a lot of people have questions about who come from a clinical background are about these reimbursement pathways. So we have a question about how can we get a better understanding of reimbursement pathways? Can you give us kind of a quick rundown of that, and then maybe are there other resources that we should look at to better understand reimbursement?
When you're talking about reimbursement, are we talking about through payers of healthcare? So
Let's
care
go with that.
pathways?
Yeah, let's go.
Yeah. Um, I think the basic the basics are beautiful again. Um, there's a few big categories to keep in mind that we didn't talk about in today's discussion, but some concepts that are important to probably engage with are this concept of fee for service reimbursement versus value-based reimbursement, which is at the heart of a lot of how we think about like how is this digital health company going to get reimbursed for its services. So in fee for service reimbursement environments, which is still vast majority of US healthcare. It's about 75% of all US healthcare, the bulk of behavioral health. In that system, we deliver services, we do tests, we have sessions with clients, and we bill on a per event basis. So everything that we do has to be accounted for with a CPT code. It has to be billed at a certain reimbursement rate, whether that's through a commercial plan or through a public payer of healthcare. And that's what most of us are really familiar with, right? If we're in environments where we are billing for our time or billing for services rendered, that's a fee for service environment. So just thinking about that pathway for a second, things that are important for digital mental health innovators to think about then is about CPT codes, basically reimbursable codes for the type of work that they're delivering in that environment. This is where, like at my first startup, we really got stuck here, right? Because we were delivering content-based guided self-help interventions for mental health. And there was at the time zero way to bill for that. And we were providing mental health coaching. There was zero way to bill for that as well. So our payer reimbursement pathway was really blocked at the time
Mhm.
because there just hadn't been as much financial innovation. Slightly different if we can find pockets of value-based reimbursement in healthcare. This means, in the most extreme set, to take the most extreme example, which is the easiest to understand, this is where we are allocated X amount of dollars to manage a population as a clinic or as a provider system. And we just do whatever we need to do to make sure that we are able to take care of them for the money that we have. And any way that we're able to provide that care in innovative and less expensive ways, we see the upside of that. That's the most extreme version of value-based care. In those environments, if you want to deliver an app, if you want to do coaching, if you want to drive people to and from the clinic, you don't need a code to reimburse for that, right? You just do
Mhm.
those services and you just manage your budget that way. So for most of our innovators, we want to be really clear on most likely, this is going beyond the question that was asked, but what I see the most often is the mission of the company has this value-based quality to it, right? We just want to be able to like manage this whole population health, get these tools out there and help people be healthy. But we have to deliver it in what's ultimately a fee-for-service environment. And that's where it gets really sticky. So we need to think about how are we going to distribute this thing? And if we're going through payers, how do we actually, what is the way that they're already billing for these behavioral health services? And what are the codes or the reimbursement tools we have at our disposal to get paid for what we're doing, which is not as lofty or exciting.
Yeah, that makes sense. I have some questions about collaboration with existing companies as opposed to starting a venture themselves.
Yeah.
Particularly questions to ask when wanting to ask slash test scientific questions before business development, as opposed to questions to ask when it is more of a commercial interest. Does that kind of make sense?
Yeah, there's actually a secret fourth step of the evaluation framework that I didn't include today just for time.
Okay.
But I call it legitimacy. So, particularly as clinicians and scientists, we're really well equipped to evaluate companies on this basis. So, I often feel I don't need to teach on it. But one one mental model I think is really helpful for clinicians and scientists to hold on to is that whatever evidence a company has produced or has already invested in, the important thing is that it's fit for what it is that they actually want to go and do in the market. Not every company is in a position where a randomized controlled trial or a multi-site trial or a high bar of clinical evidence is going to be helpful to them in the market. The ones where that is most important are going to be selling to more sophisticated entities. If you're selling to a payer type, if you're selling to a self-insured employer, typically we see a higher bar, partly because there's a lot of solutions to choose from, and they're very focused on ensuring that they can deliver the ROI and the outcomes that they need from these solutions. When we're looking at consumer products, as clinicians and scientists, we're really well equipped to say, does this have the ingredients it needs to be effective, and how have you started to look at that? But oftentimes, real world data is really important to see. We also want to see evidence of desirability, of uptake, of engagement. So if no one uses it, it doesn't really matter if it works or not, right? So there's different levels of evidence for different market needs. And the bar, they just need to match. If we're trying to make claims in market that the FTC is going to review about how well our product work or how it treats a certain condition, then that's the highest bar. Then it goes all the way down from there.
Mhm.
Um, I don't know if that's
No,
helpful
that
for the
makes
question, but
yeah. Um, Here's a sticky one, and then we'll end on this. We'll end on something a little bit.
Ooh.
Why do you think the engineers and founders are reluctant to listen to the advice of experienced clinicians, particularly those who
Mm.
in digital health?
Hmm. I think many of us have had this experience, right? And I've had it too. I've come to see it in a few ways. I think there's part that's on us and part that's on them. If we focus on the part that's on us, that's in our ability to control. I think very often as clinicians and as scientists, we we know this space really well, right? And we have our expertise and we understand healthcare and we understand treatment and we understand patients. And that actually sometimes makes it really difficult for us to engage in the necessary steps of innovation. Like it makes it difficult for us to meet in the middle to say, look, this is everything that I know about the evidence base, about how this treatment should be delivered, about how this product should work. And it can be really hard for us to actually hold that lightly and set that down and say, but how are we going to do it here? But how do we work on it in this new way that actually no one has figured out yet? Where are my bright lines on what must be true and where can I approach with flexibility to say, how do we co-create this together? A
Hmm.
part of this is about the stance we take. Do we approach as an expert who should be able to influence from a place of authority? And do we get kind of do our feathers get kind of ruffled when in this startup context that authority doesn't hold the same weight that it does in other places? That's an icky feeling. It's a hard feeling. But it's one that we often need to work through. And then a little bit is, what we covered today. I think we all need to speak the language that's appropriate for the environment that we're in. So for clinicians and scientists, we can sometimes get that wall put up to us, and it gets really hard for people to hear us or engage with us when we have difficulty framing what it is we want to say in the stuff that matters to our audience.
Hmm.
So if we notice a clinical or scientific problem, how does that connect to what we're trying to achieve in the business? How do we make it make sense and get the main point across in a way that helps other people understand why this is a priority or why this is an issue? And how do we approach even that from a place of like, here's the problem that I see that I think we need to address or work on versus, hey, this is what the solution is that you need to go do. That's sort of an immediate shutdown usually in startup conversations. Um, I often think it's helpful to think about the side that we can control. How can we show up? How can we be flexible? How can we use the language? How can we bring a mindset of innovation and adaptability and flexibility? And that doesn't mean that there's not bad actors and malintent and some nasty biases potentially from the other side, but very often I find we can see huge transformations when we just do our half of it, which I find hopeful.
Nice. All right. Thank you so much, Dr.
My
Claire.
pleasure. Thank you all so much for having me.
I know we have some other
Let me.
questions that weren't answered. We will try and follow up on those. We'll try and reach out. And some of the questions that were asked today, I do want to try and answer with some announcements that we have. So Claire, I'm going to switch over. I'm going to go ahead
Yeah.
and share screen here just for a second so we can get through these as quickly as possible. But we have some exciting things to share with you. So our next quarterly webinar will be the future of implementation science and AI in digital mental health, presented by Dr. Shannon Wiltsey Sturman, and that will be March 10th. So I know some questions in the chat we had were about implementation with AI and how that looks. So please be sure to join us on March 10th. You won't want to miss out on that. Next, we are announcing for the first time on this call that the following webinar after the March webinar will be led by a candidate yet unknown. And that is because we are announcing that as of today, applications are now open for the CBIT's Future of Digital Mental Health Rising Star Award. The purpose of this award is to spotlight an outstanding early career investigator whose research is paving the way for innovation and impact in digital mental health. And the awardee will be invited to present at CBIT's final The Future of webinar for the academic year on May 19th, 2026, and will receive a $250 honorarium for their important contribution. So applications are now open through January 30th, and all application information can be found on our website, which is available at that QR code. But wait, there's more. We are also announcing that registration is now open for our Design for Digital Health reading course, which is a free bi-weekly 8-week course we offer annually, January through April. So I know there were some questions about how do I break into this? How do I learn more about the basics? This is an excellent opportunity to do that. We're providing an introduction to design for digital health technologies. This is led by two core faculty members and experts in human-centered design methodologies, Doctors Andrew Barry and Kaylee Cruzan. So you won't want to miss out on that. And all that information is also available on our website. And lastly, this year, CBITS has opened a new pathway to partnerships with our center. So CBITS has created a partnership portal on our site where we offer our services for those looking for expertise in designing, developing, evaluating, and implementing digital health tools. We're open to partnering across sectors, including industry, academia, nonprofits, community-based organizations. So please go to our website and fill out that form if you're interested in seeking that expertise. We'd love to work out an agreement with you and see if our services can be of use. And if you're registered for this series, since you're here, you will be receiving an email with all of this information, so not to worry. But I'd like to close out by thanking members of my team, our communications coordinator, Shannon Smith, our director of operations, Charlie Kraus, who was helpful in making this happen today. And of course, a big thank you to Dr. Clare Purvis for her incredible presentation. Thank you for making the time to meet with us, for your incredible dedication to the advancement of digital mental health in industry. And thank you all for coming today, and I hope you have a wonderful day. Thanks again, and we'll talk to you soon.